First, on the economic front, because of the work we have done in reducing the infection rate in our state and reducing the hospitalization rate, we are now eligible to move forward on phase 3 of our economic recovery plan. I'm pleased to announce this. On March 22nd, every county in the state of Washington will be eligible to move forward to phase 3 in our reopening plan. And here's what this means. For essentially all indoor activities that are allowed, they will now be allowed up to 50% of capacity, up from 25, doubling our capacity. We're real happy about this. This means our restaurants, gyms, fitness centers, movie theaters, some of the hardest hit businesses in the Washington state will be able to return to 50% capacity. This is also going to include large outdoor and indoor facilities that can hold up to 400 people. This was provided it would not exceed 50% of capacity. This includes high school graduation ceremonies as well as concerts. Other minor industry-led changes are also coming to some categories. For example, alcohol service now will be cut off at midnight instead of 11 p.m. And our team is still working with industries to finalize some of the details in these industry-led changes. Those will be released next week. On March 22nd, we take one more step in beating the virus and reopening our economy. Now, because of the progress we've made in reducing the incidence of this disease, as well as our tremendous efforts to get people vaccinated, our reopening plan is now based on a on a county rather than regional basis. So the State Department of Health will evaluate progress every 3 weeks, and the first review will be April 12th. All counties' success under this plan will be monitored by 2 health metrics: the new COVID cases they experience per 1,000 and new COVID hospitalizations. Similarly, smaller counties will have a somewhat different criteria. For counties with more than 50,000 residents, that's 22 counties total, the rates you see on this graph will determine whether a county stays or moves in phases. This plan has an additional fail-safe. If at any point statewide ICU capacity reaches 90%, the county would have to move backwards into the previous phase. Now, we're excited to take this step forward. We're going to keep evaluating our progress. We think there's reason to be optimistic, and we think this gives us a way to keep moving forward. Second, on the issue of sports. So additionally, we're making changes to our sports guidance to allow more people to enjoy great athletic performances. It's been a year now since we've had a reduction in our chance to be spectators at sporting events. We're now at a point where we can safely move forward. So this applies to outdoor venues with permanent seating, and capacity will now be open up to 25%. What this means is, an opening day, we will be singing Take Me Out to the Ball Game, and we will be going to the ball game with the Mariners and other games. So the Mariners will be able to welcome fans up to, I think it's about 9,000 people on opening day. And of course, that's just one of our incredible teams that will be open in this regard. So this will have an impact, obviously, on more than the Mariners. It'll include Sounders, OL Reign. It'll also additional capacity for high school sports, and we're really glad to be able to do that. It'll also allow motorsports, rodeos, and other outdoor spectator events under these same protocols. Now, obviously, we want to do this safely, so this will include protocols on doing this involving mask wearing, distancing, and other protocols. Also, assuming we continue to make progress, we're going to reevaluate this capacity limit in April and potentially increase the capacity limit on areas such as minor league baseball. We'll take a look at that in mid-April. We're also working on guidelines for summer camps and for safe and healthy expansion of youth sports. High contact sports like basketball, wrestling, and cheerleading will be allowed to have competitions again. Obviously, masks will continue to be required. And our hope is having more sports available for students is going to keep more engaged. We know how important this is. And I really appreciate you sports, all of those volunteers who are helping coaching and reffing. This physical activity we think is really important in our mental health for our children as well. We hope these will go into effect as quickly as possible. I'm hoping we'll get those in place next week. So more to be said next week. Third, we're making big progress on the vaccine front. We now made good progress so that about 60% plus of our population age 65 has been vaccinated. We're also starting to see more open appointments around the state, and we want to keep filling up those appointments. So I'm very happy to announce that we will move to the next tier of eligibility here earlier than we thought. So on Wednesday, March 17th, everyone in Tier 2 will be eligible for the COVID vaccine. Now this tier includes workers in agriculture, food processing, grocery stores, public transit, firefighters, law enforcement, as well as workers in corrections, jails, and detention centers. It also includes over 16-year-olds who are pregnant or who have a disability that puts them at a high risk. This is another tremendous step forward in our fight against this pandemic. We're glad to be able to advance this even a week earlier than we thought we were going to be able to do, to get more shots into arms as quickly as possible. Now, I would also reiterate, for those who are already eligible, you will remain eligible, and this is an important point. If you're over 65, you haven't had your vaccine yet, and for whatever reasons you haven't had it by March 17th, you will continue to be eligible throughout this entire pandemic. So those folks who on March 17th are eligible who haven't got it for one reason or another, maybe they didn't want to get it at that point, you will remain eligible throughout the vaccine program. And we encourage everyone to do this. This is a medical miracle. We have 3 extremely efficacious vaccines. Every day there is better news about how effective they are in saving lives, saving hospitalizations, and saving your loved ones.